Question 1. Samantha is a professional animal care worker at a local shelter and is assigned to care for a group of shelter dogs. She notices that one of the dogs, Max, is displaying aggressive behavior towards other dogs in the same enclosure. Max has been recently brought to the shelter after being found abandoned on the street. Samantha is concerned that Max's behavior might escalate if not addressed properly. What should Samantha do in this situation? A. Ignore Max's behavior, as he is likely stressed due to the shelter environment and the behavior will eventually subside on its own. B. Continue with the daily routine but separate Max from other dogs and monitor his behavior closely for signs of improvement. C. Aggressively confront Max to correct his behavior by using harsh disciplinary methods. D. Immediately remove Max from the shelter environment and place him in a solitary confined area without further assessment. Answer. B. Continue with the daily routine, but separate Max from other dogs and monitor his behavior closely for signs of improvement. Explanation. Max's aggression is likely due to stress or fear following his abandonment and the new shelter environment. While his behavior should not be ignored, harsh or aggressive correction is not recommended as it could further escalate the stress and lead to more severe behavior issues. The best approach would be to separate Max from other dogs to avoid further conflict while monitoring his behavior closely. Behavioral assessment and training, including positive reinforcement techniques, should be implemented to modify his aggressive tendencies in the long run. This approach aligns with industry best practices for animal behavior management, ensuring that Max's welfare is prioritized while reducing the risk of injury to other animals and staff. The ethical treatment event, especially under stress, is a key principle in animal care regulations. Question 2. Which of the following is the most appropriate method of administering medication to an animal that requires a regular oral dose of a prescribed drug but is known to be difficult to handle? A. Administer the medication with food or a treat that the animal enjoys, ensuring that the animal consumes it willingly. B. Forcefully hold the animal and insert the medication directly into its throat without considering the animal's comfort. C. Skip the medication if the animal refuses it, as forcing it could lead to further aggression. D. Administer the medication through injection to avoid the problem of oral administration altogether. Answer A. Administer the medication with food or a treat that the animal enjoys, ensuring that the animal consumes it willingly. Explanation. The key to effective medication administration in difficult-to-handle animals lies in reducing stress and creating a positive experience for the animal. This can be achieved by hiding the medication in a treat or food that the animal enjoys. This technique is non-invasive and ensures the animal consumes the medication with physical force or stress. It aligns with ethical treatment principles and industry standards regarding the administration of medication. Forcing the medication into an animal's throat, option B, can lead to trauma and heighten fear or aggression, which would undermine future handling attempts. Skipping medication, option C, could compromise the animal's health, and using injections unnecessarily, option D, should only be considered if oral administration not possible for medical reasons, not as first option. Question 3. A shelter worker is responsible for cleaning the enclosures of several reptiles. One of the reptiles, a python, has just shed its skin. The worker notices some residual skin still stuck on the python's head and tail. What should the worker do in this situation? A. Leave the stuck skin on the snake and proceed with cleaning other enclosures, as the snake will eventually shed the skin on its own. B. Gently attempt to remove the stuck skin by using tools such as tweezers or gloves without stressing the snake. C. Immediately take the snake to the vet, as the stuck skin could be a sign of a medical issue requiring professional intervention. D. Ignore the stuck skin, as it is not a critical issue and will not affect snake's health. Answer. B. Gently attempt to remove the stuck skin by using tools such as tweezers or gloves without stressing the snake. Explanation. In reptiles like pythons, retained shed skin can cause issues such as constriction or skin infections if not removed. It is important to address this promptly but gently to avoid stressing or injuring the snake. The worker should use appropriate handling tools such as tweezers or gloves and carefully remove the remaining skin. This is a standard procedure in reptile husbandry that should be performed with care to avoid causing harm to the animal. Taking the snake to the vet. Option C would be necessary if the snake exhibits signs of illness, but removing the skin is generally within the scope of basic care. Leaving the skin, option A, could lead to health complications, and ignoring it, option D, could result in infection or other issues that compromise the snake's well-being. Question 4. A veterinarian has recommended that a dog be placed on a special dietary plan to help manage its obesity. The dog is known to have a sensitive stomach, and it is important that the diet plan does not cause gastrointestinal distress. Which of the following steps should the animal care worker take to ensure the dog follows the prescribed dietary plan? A. Gradually introduce the new food over a period of 7 1-hour days to allow the dog's digestive system to adjust. B. Immediately switch the dog to the new diet without any transition period, as this will speed up the weight loss process. C. Feed the dog with the same amount of food as the previous diet, but just change the brand to more affordable one. D. Increase the dog's food intake to compensate for any potential new efficiencies that may arise from the new diet. Answer 8. Gradually introduce the new food over a period of 7 1-0 days to allow the dog's digestive system to adjust. Explanation. When switching dog's diet, especially for sensitive stomach or specific health conditions like obesity, it is essential to introduce the new food gradually over 7 1-0 days. This allows the animal's digestive system to adapt to the new ingredients without causing gastrointestinal distress, vomiting or diarrhea. Abruptly changing the diet, option B, can result in digestive upset and is not recommended, especially for animals with sensitive stomachs. Simply changing the brand without adjusting portion sizes, option C, may not address the weight loss goals, and increasing the food intake, option D, would counteract the purpose of the diet plan, potentially exacerbating the obesity problem. Question 5. Alex works as an animal care assistant at a farm, and he is assigned to assist with the birth of a pregnant sheep. The sheep is showing signs of labor and the birth is imminent. As the lamb is being delivered, Alex notices that the lamb is not breathing immediately after birth. What should Alex do first? A. Wait for the lamb to begin breathing on its own, as the process might take a few minutes. B. Use a towel to gently stimulate the lamb's chest and wipe away any mucus from its nose and mouth. C. Immediately attempt to administer artificial respiration by mouth to mouth. D. Call veterinarian and wait for their instructions before taking any further action. Answer. B. Use a towel to gently stimulate the lamb's chest and wipe away any mucus from its nose and mouth. Explanation. When lamb is not breathing immediately after birth, the first step is to clear its airways by gently wiping away any mucus or amniotic fluid from the nose and mouth. Gently stimulating the chest with towel can also help encourage the lamb to breathe. Artificial respiration, option C, should only be attempted if the lamb does not begin to breathe on its own after airway clearance. Waiting for the lamb to breathe on its own, option A, may be appropriate in some cases, but it is better to take immediate action to clear its airways and stimulate it to breathe. Calling veterinarian, option D, is advisable if the lamb does not breathe after these steps or if there are complications, but immediate action should not be delayed. Question 6. A dog in a shelter has been diagnosed with a skin infection caused by a bacterial overgrowth. The veterinarian has prescribed antibiotics for treatment. The animal care worker is tasked with administering the medication. What should the worker be aware of when giving antibiotics to the dog? A. Antibiotics should always be given with food to avoid stomach upset, unless otherwise instructed by the veterinarian. B. The full course of antibiotics should be completed even if the dog shows signs of improvement before finishing the medication. C. Antibiotics can be stopped early if the dog appears to have recovered to prevent overuse of medication. D. The dog should be given antibiotics on an empty stomach to increase absorption. Answer. B. The full course of antibiotics should be completed even if the dog shows signs of improvement before finishing the medication. Explanation. When administering antibiotics, it is critical that the full course of the prescribed medication is completed even if the dog shows signs of improvement before the treatment is finished. Stopping antibiotics prematurely, option C, can lead to the infection not being fully treated, potentially resulting in development of antibiotic-resistant bacteria. Administering the antibiotics with food, option A, is generally appropriate unless the veterinarian specifically advises otherwise, as food can help prevent stomach upset. Giving antibiotics on an empty stomach, option D, may sometimes be recommended for certain medications, but not for all antibiotics, and it should be done only with specific guidance from the veterinarian. Question 7. Anna works in a veterinary clinic and is tasked with cleaning and sterilizing surgical instruments. Which of the following procedures is the most critical to ensuring that all instruments are free of bacteria before being used in a surgery? A. Rinse the instruments with cold water to remove visible debris, then sterilize them in an autoclave. B. Wash the instruments with soap and warm water, then Sterilize them in an autoclave. C. Sterilize the instruments in an autoclave without washing them, as the autoclave will kill any bacteria. D. Use a disinfectant wipe on the instruments before sterilizing them in the autoclave. Answer B. Wash the instruments with soap and warm water, then sterilize them in an autoclave. Explanation: the proper sterilization of surgical instruments begins with the careful washing and cleaning of the instruments to remove all visible debris, organic material, and bacteria. Soap and warm water, option B, are effective in cleaning instruments before they are placed in the autoclave, which uses high-pressure steam to kill bacteria and other pathogens. Rinsing with cold water, option A, is not recommended as it can allow organic material to harden and make it more difficult to clean. Simply sterilizing without washing, option C, would not effectively remove bacteria or organic material, and using only disinfectant wipes, option D, would not be sufficient to ensure proper sterilization for surgical procedures. Question 8. Ben is working at an animal shelter and notices the dog that has not eaten for the past 24 hours. The dog is lethargic and appears to be in pain. Ben also observes that the dog's gums are pale. What should Ben do next? A. Wait for the dog to eat on its own, as dogs may sometimes refuse food due to stress. B. Provide the dog with more appealing food to encourage eating, but do not intervene further. C. Take the dog to the shelter's veterinarian immediately for full examination, as these symptoms could indicate serious health issue. D. Give the dog water and continue monitoring its condition without taking further action. Answer: C. Take the dog to the shelter's veterinarian immediately for full examination, as these symptoms could indicate serious health issue. Explanation: the symptoms displayed by the dog, loss of appetite, lethargy, pain, and pale gums, suggest that the dog may be experiencing medical condition that requires immediate attention. These signs could indicate a variety of serious health issues such as anemia, infection, or internal injury. Waiting for the dog to, option A, or only providing more appealing food, option B, may delay necessary treatment and worsen the dog's condition. Giving the dog water and monitoring its condition, option D, is insufficient without professional evaluation. Immediate consultation with veterinarian is essential to determine the cause and begin appropriate treatment. Question 9. Megan, an animal care worker at a wildlife rescue center, is tasked with monitoring a group of injured birds that are recovering from their injuries. One of the birds has developed swelling in its leg which appears to be worsening. What should Megan do in this situation? A. Apply ice to the swelling and continue monitoring the bird for any changes. B. Immediately contact the veterinary team to assess the injury and determine the appropriate course of action. C. Administer pain relief medication to the bird without consulting the veterinarian. D. Keep the bird in isolation until the swelling goes down and avoid taking any other action. Answer: B. Immediately contact the veterinary team to assess the injury and determine the appropriate course of action. Explanation: swelling in an injured bird could indicate an infection, internal injury, or other serious complications that need to be addressed by a veterinary professional. The appropriate action is to contact the veterinary team immediately to assess the bird's condition and determine whether further treatment, such as pain management, immobilization, surgery is required. Applying ice, option A, without veterinary advice could be harmful if not done properly, and administering medication, option C, without consultation could lead to incorrect treatment or harm. Keeping the bird isolated, option D, without proper veterinary intervention could allow the injury to worsen. Question 10. A shelter worker is tasked with cleaning a cat's enclosure. While cleaning, the worker notices that the cat is sneezing frequently and has discharge from its eyes. What should the shelter worker do first? A. Continue cleaning the enclosure and monitor the cat's condition for a few more days. B. Contact veterinarian for an evaluation, as these could be symptoms of an upper respiratory infection. C. Isolate the cat from other animals to prevent any potential spread of illness but take no further action. D. Administer an over-the-counter cold medication to the cat to alleviate its symptoms. Answer: B. Contact a veterinarian for an evaluation, as these could be symptoms of an upper respiratory infection. Explanation: sneezing and discharging cats are common signs of an upper respiratory infection, which can be highly contagious in shelter environments. The shelter worker should contact a veterinarian immediately to ensure the cat receives proper diagnosis and treatment. Continuing to monitor the cat, option A, could allow the infection to or spread. Isolating the cat, option C, is important to prevent the potential spread, but A veterinary evaluation is still needed for appropriate care. Administering over-the-counter medications, option D, without veterinary guidance could harm the cat and delay proper treatment. Question 11. Emily works at a rescue center and has just received a dog that was found wandering on the streets. The dog is very thin, has a lot of mats in its fur, and is showing signs of dehydration. What should Emily do first to assess the dog's health? A. Immediately give the dog food and water to rehydrate and gain weight. B. Thoroughly groom the dog to remove the mats in its fur before any medical treatment. C. Take the dog to veterinarian for full medical checkup to assess its dehydration and overall health. D. Allow the dog to rest and wait day to see if it improves on its own before seeking medical attention. Answer: C. Take the dog to a veterinarian for a full medical checkup to assess its dehydration and overall health. Explanation: the dog's dehydration and malnutrition are serious concerns that require immediate veterinary attention. Dehydration can have severe effects on the dog's health, and the mats in its fur could indicate neglect or history of poor care. Veterinarian will need to assess the dog's hydration status, check for underlying health conditions, and begin any necessary treatments such as intravenous fluids, nutrition, and medications. Providing food and water, option A, may worsen the dog's condition if done incorrectly or without knowing its specific needs, and grooming, option B, should only be done after the dog is stabilized. Waiting to see if the dog improves on its own, option D, is not advisable given the potential severity of its condition. Question 12. A cat in a shelter has recently undergone surgery to remove a tumor. The veterinarian prescribes a pain reliever to be administered orally. Which of the following is most important when giving the medication to the cat? A. Administer the medication directly after the cat eats its meal, as this will enhance the drug's effectiveness. B. Ensure the cat receives the full dose at one time to maintain consistent pain relief throughout the day. C. Monitor the cat for any signs of side effects, such as vomiting, diarrhea, or lethargy after administering the medication. D. Only administer the medication when the cat shows signs of discomfort, rather than as prescribed. Answer: C. Monitor the cat for any signs of side effects, such as vomiting, diarrhea, or lethargy after administering the medication. Explanation: after administering pain relievers, it is crucial to monitor for any signs of side effects such as gastrointestinal distress, lethargy, or allergic reactions. Although giving medication after a meal, option A, can sometimes help reduce stomach upset, the primary focus should be on monitoring the response to the medication. Administering the full dose, option B, at one time might not be advisable if the cat experiences side effects, and medication should be given according to the prescribed schedule. Only giving the medication when the cat shows signs of discomfort, option D, could result in inadequate pain management, potentially hindering the cat's recovery. Question 13. A puppy has been brought into a shelter after being found abandoned in a cardboard box. The puppy appears to be underweight, with ribs visible, and seems to be trembling. What should be the first step in caring for the puppy? A. Provide the puppy with a warm bed, food, and water immediately and wait for further instructions. B. Take the puppy to the shelter's veterinarian to assess its health before providing food or water. C. Give the puppy some food and water to encourage it to eat, as it is likely hungry. D. Place the puppy in an isolated area away from other animals to avoid the spread of possible diseases. Answer: B. Take the puppy to the shelter's veterinarian to assess its health before providing food or water. Explanation: the puppy's underweight condition, visible ribs, and trembling are signs that it may be suffering from more serious health issues such as dehydration, hypothermia, or malnutrition. Before offering food or water, it is important to first take the puppy to a veterinarian for a health assessment. Overfeeding or providing water without proper assessment can cause further harm, especially if the puppy's body is not ready to handle food after a period of neglect. While isolating the puppy, option D, is important to prevent disease transmission, the priority should be to assess the puppy's immediate health needs. Question 14. A rabbit in an animal rescue center has been diagnosed with gastrointestinal stasis, a common digestive condition in rabbits. The veterinarian prescribes a special diet and medications. What should the animal care worker focus on during the treatment of this condition? A. Ensure that the rabbit has access to unlimited fresh hay and water to aid digestion. B. Only provide the prescribed medications and avoid any other food or supplements. C. Limit the rabbit's water intake to prevent further digestive upset. D. Encourage the rabbit to rest and avoid activity, as movement could worsen the condition. Answer: Pay. Ensure that the rabbit has access to unlimited fresh hay and water to aid digestion. Explanation: Gastrointestinal stasis in rabbits requires prompt attention to their diet and hydration. Rabbits need access to unlimited hay as it provides the fiber necessary for proper digestion and motility in their gastrointestinal tract. Water is equally important for maintaining hydration and promoting normal digestive function. Medications prescribed by the veterinarian. Option B should be given as directed, but the focus should not solely be on the medication. Diet and hydration are key components of treatment. Limiting water, option C, and restricting activity, option D, can worsen the condition as it can slow digestion and contribute to further complications. Question 15. A cat at an animal shelter has a large wound on its leg that appears to be infected. The shelter worker is unsure whether the wound requires stitches. What is the first step the worker should take in this situation? A. Apply an antiseptic solution to the wound and allow the cat to heal on its own. B. Immediately contact the shelter's veterinarian to assess whether the wound needs stitching or other treatment. C. Wrap the wound tightly with bandage to stop any bleeding, then check again in 24 hours. D. Isolate the cat from other animals to prevent infection and wait until it heals. Answer: B. Immediately contact the shelter's veterinarian to assess whether the wound needs stitching or other treatment. Explanation: When dealing with an infected wound, especially one that may require stitches, it is critical to consult with veterinarian as soon as possible. The veterinarian will assess the severity of the wound, determine whether stitches are necessary, and decide on an appropriate course of treatment, which may include cleaning, antibiotics, or medical care. While antiseptic treatment, option A, can be part of the wound care process, it should not be the first step without veterinarian's input. Wrapping the wound, option C, or isolating the cat, option D, may be appropriate later, but the priority should be to seek professional care. Question 16. A dog in a kennel has been exhibiting signs of stress, such as excessive barking, drooling, and pacing since it was brought in for boarding. The animal care worker is unsure how to address the dog's stress. Which of the following should be the most immediate action taken to reduce the dog's anxiety? A. Increase physical activity by taking the dog for long walks to tire it out. B. Provide the dog with a familiar blanket or toy to offer comfort and a sense of security. C. Immediately isolate the dog from other animals to avoid further stimulation. D. Ignore the behavior and wait for the dog to calm down on its own, as it is likely a temporary reaction. Answer: B. Provide the dog with a familiar blanket or toy to offer comfort and a sense of security. Explanation: Stress in animals can be caused by changes in their environment, and providing a familiar item such as a blanket or toy can offer the dog a sense of security and help reduce anxiety. Familiar scents and objects have been shown to help dogs feel more comfortable in stressful situations. While physical activity, option A, can help alleviate stress, it may also increase excitement or anxiety in a stressed dog. Isolating the dog, option C, may reduce stimulation but could worsen the dog's sense of isolation, and waiting for the dog to calm down, option D, without intervention, may lead to prolonged stress and behavioral issues. Question 17. You are tasked with administering medication to a horse under your care. The veterinarian has prescribed a sedative to be administered intramuscularly. What is the first thing you must ensure before administering the medication? A. Confirm the horse's weight to calculate the correct dose of the sedative. B. Ensure that the medication is given on an empty stomach to improve absorption. C. Check the medication's expiration date to ensure its effectiveness. D. Administer the medication in the horse's neck to minimize the risk of injury. Answer: C. Check the medication's expiration date to ensure its effectiveness. Explanation: Before administering any medication, it is essential to ensure that the medication is still effective by checking its expiration date. Option C. Expired medications may lose potency and could be harmful or ineffective. While confirming the horse's weight, option A, is important for proper dosing, the priority is to ensure that the medication is safe and effective for use. Giving the medication on an empty stomach, option B, is not always necessary, especially for sedatives. Administering the injection in the horse's neck, option D, is common practice but should be done with caution. It is more important to ensure the medication is still within its valid shelf life. Question 18. A rabbit in your care has shown signs of gastrointestinal issues, including bloating and reduced appetite. After a vet consultation, the rabbit has been diagnosed with geese stasis. Which of the following actions should be prioritized to help the rabbit recover? A. Offer the rabbit unlimited access to hay and water to stimulate digestion and prevent dehydration. B. Provide the rabbit with small portions of fresh fruit to encourage eating. C. Limit the rabbit's activity and encourage rest to avoid further stress. D. Immediately administer pain relief and anti-inflammatory medications to the rabbit without veterinary consultation. Answer A. Offer the rabbit unlimited access to hay and water to stimulate digestion and prevent dehydration. Explanation. In cases of gastrointestinal stasis, it is crucial to offer unlimited access to hay and water, as the fiber in hay helps stimulate digestion and prevent dehydration, which are key factors in recovery. Offering fresh fruit, option B, might be tempting, but it's important to focus on providing high-fiber foods and water to address the primary issue. Limiting activity, option C, can be beneficial, but it should not come at the expense of providing the necessary diet and hydration. Administering pain relief and anti-inflammatory medications, option D, should only be done under veterinary supervision, as incorrect usage or dosages could exacerbate condition. Question 19 scenario. Mr. Lawson works as a wildlife rehabilitator and has received an injured bird with a broken wing. The bird is in obvious pain, and Mr. Lawson suspects that the injury might require surgery. He doesn't have immediate access to a veterinarian. What should Mr. Lawson do first to ensure the bird's safety and well-being until he can get it proper veterinary care? A. Apply splint to the bird's wing to stabilize it and keep it in a warm, quiet environment while waiting for veterinary care. B. Immediately attempt to set the wing back into position, ensuring it is aligned correctly. C. Offer the bird food and water to provide nourishment while it waits for surgery. D. Leave the bird in its current condition and wait for the vet to arrive without intervening. Answer A. Apply a splint to the bird's wing to stabilize it and keep it in a warm, quiet environment while waiting for veterinary care. Explanation. The first step in handling an injured animal is to stabilize it and ensure it is as comfortable as possible. Applying a splint to the bird's wing, option A, helps prevent further damage and reduces pain. A warm, quiet environment will reduce stress and help keep the bird calm until veterinary available. Attempting to set the wing, option B, could cause more harm if not done properly. Offering food and water, option C, should only be done after stabilizing the bird's condition and should not take priority over managing the injury. Leaving the bird untreated, option D, could worsen the situation by allowing the injury to become more severe. Question 20. A shelter worker notices that a dog in the kennel is excessively scratching and biting its fur. Upon inspection, the dog has several red, inflamed areas on its skin. What is the most appropriate course of action for the shelter worker to take? A. Treat the dog with an over-the-counter flea and tick medication to address possible external parasites. B. Immediately take the dog to the veterinarian to assess for allergies, infections, or parasites. C. Ignore the symptoms, as they are likely caused by normal shedding or seasonal allergies. D. Apply a topical soothing cream to the affected areas and monitor the dog's condition. Answer. B. Immediately take the dog to the veterinarian to assess for allergies, infections, or parasites. Explanation. The presence of red, inflamed areas on the dog's skin along with scratching and biting suggests the possibility of an underlying health issue such as allergies, skin infections, or parasites. It is important to take the dog to a veterinarian as soon as possible to determine the cause and provide appropriate treatment. Treating with over-the-counter medications, option A, without a proper diagnosis could mask the symptoms and delay appropriate care. Ignoring the symptoms, option C, could lead to worsening conditions, and applying a soothing cream, option D, may not address the underlying cause of the symptoms. A veterinarian's examination is necessary to ensure the dog receives proper care. Question 21. You are working in an animal shelter and are asked to assist with the socialization of a group of kittens. Some of the kittens are shy and hesitant to approach humans, while others are more confident. What is the best approach to help the shy kittens become more comfortable around people? A. Force the shy kittens to interact with humans to encourage them to become more confident. B. Allow the shy kittens to approach humans at their own pace using treats or toys to encourage positive interactions. C. Keep the shy kittens isolated from humans until they show interest in interacting. D. Encourage the confident kittens to interact more with the shy ones to build social skills. Answer. B. Allow the shy kittens to approach humans at their own pace using treats or toys to encourage positive interactions. Explanation. Shy kittens should be allowed to approach humans on their own terms, as forcing interaction can cause stress and make them more fearful. Using treats or toys to create positive associations with human contact can help build their confidence over time. Isolating them, option C, will not help with socialization, and while confident kittens might help, it's important not to pressure the shy ones to interact if they are not ready. Question 22. A guinea pig in your care has been diagnosed with scurvy due to a lack of vitamin C in its diet. Which of the following foods should you introduce to the guinea pig's diet to help treat and prevent scurvy? A. Carrots and spinach, which are rich in vitamin C. B. Apples and bananas, as they provide vitamin C in large amounts. C. Fresh green leafy vegetables, such as parsley and kale. D. Oats and barley, as they provide fiber and vitamin C. Answer: C. Fresh green leafy vegetables, such as parsley and kale. Explanation: guinea pigs require a source of vitamin C in their diet, as they cannot produce it themselves. Fresh green leafy vegetables like parsley and kale are excellent sources of vitamin C and should be added to their diet to treat and prevent scurvy. Carrots, option A, and fruits, option B, contain some vitamin C but are not as high in it compared to leafy greens. Oats and barley, option D, are high in fiber but do not provide significant amounts of vitamin C. Question 23 scenario: you are caring for a bird with a broken wing. The bird is calm but needs to be transported to a wildlife rehabilitation center. How should you safely handle the bird for transport? A. Grasp the bird by its wings to prevent it from escaping. B. Place the bird in a small, secure box with soft padding to minimize movement. C. Hold the bird in your hands to monitor its condition during transport. D. Use a net to capture the bird and immediately place it in a cage for transport. Answer: B. Place the bird in a small, secure box with soft padding to minimize movement. Explanation: when transporting an injured bird, the goal is to minimize further injury and stress. A small, secure box with soft padding will prevent the bird from moving too much, reducing the risk of aggravating its injury. Grasping the bird by its wings, option A, could worsen the injury, and holding the bird in your hands, option C, is not safe or comfortable for the bird during transport. Using a net, option D, could cause unnecessary stress and injury. Question 24. A large dog in the shelter is having difficulty adjusting to a new environment and is displaying signs of territorial aggression. The dog growls and lunges at new people who approach its kennel. What should be the best course of action to safely manage this behavior? A. Allow the dog to act out its aggression to establish its dominance in the kennel. B. Use a muzzle and allow the dog to interact with new people to get used to them. C. Keep the dog separated from other animals and people and allow it time to adjust to its new surroundings. D. Encourage the dog to approach new people immediately to face its fear. Answer: C. Keep the dog separated from other animals and people and allow it time to adjust to its new surroundings. Explanation: territorial aggression can be caused by stress and a sense of insecurity in the new environment. It is important to give the dog time to adjust to its new surroundings while keeping it separated from other animals and people to avoid escalating the behavior. Using a muzzle, option B, should only be considered if the dog is a danger to others, but it's better to avoid forcing interaction. Option D, until the dog is more comfortable. Encouraging the dog to act out aggression, option A, is not safe or effective solution and could lead to more behavioral issues. Question 25. You notice that a rabbit in your care is frequently grinding its teeth, a behavior it usually exhibits when stressed. However, the rabbit also has a decreased appetite and seems lethargic. What is the most appropriate action to take in this situation? A. Observe the rabbit closely for a few days to see if the behavior resolves on its own. B. Immediately isolate the rabbit from other animals to reduce stress. C. Provide the rabbit with fresh vegetables and high-fiber foods to encourage eating. D. Take the rabbit to a veterinarian for a full assessment of its health. Answer: D. Take the rabbit to a veterinarian for a full assessment of its health. Explanation: teeth grinding in rabbits can be a sign of pain or discomfort, especially if it is accompanied by decreased appetite and lethargy. This could indicate a serious health issue such as gastrointestinal stasis, dental problems, or another underlying condition. It is important to take the rabbit to a veterinarian for a thorough examination while offering fresh and high-fiber foods. Option C can be beneficial. The underlying health issue needs to be addressed first. Isolating the rabbit, option B, or simply observing it, option A, is not enough to ensure its well-being in this case. Question 26. You are working in an animal shelter where a cat is displaying signs of severe stress, such as hiding, excessive grooming, and refusal to eat. What is the most appropriate approach to manage this cat's behavior? A. Leave the cat alone in the hope that it will adjust over time and come out of hiding. B. Place the cat in a quieter, less stimulating environment to help reduce stress. C. Force the cat out of its hiding place and try to engage it with food and toys. D. Immediately administer sedatives to calm the cat and reduce its stress. Answer: B. Place the cat in a quieter, less stimulating environment to help reduce stress. Explanation: stress in cats can lead to behaviors such as hiding, excessive grooming, and reduced appetite. Providing a quieter, less stimulating environment can help the cat feel safer and more secure, allowing it to relax and reduce its stress levels. Forcing the cat out of its hiding spot, option C, or sedating it, option D, is not an effective long-term solution. Giving the cat time and space, option A, is important, but it needs the calmer environment to recover from stress. Question 27. A dog in your care has a history of separation anxiety, which leads to destructive behavior when left alone. What is the most effective way to help the dog manage its anxiety while ensuring safety? A. Leave the dog alone in a confined space with plenty of toys to keep it distracted. B. Gradually increase the dog's time spent alone in a controlled and positive environment. C. Use a crate to restrict the dog's movement and prevent destructive behavior. D. Ignore the dog's anxiety as it will eventually get used to being left alone. Answer: B. Gradually increase the dog's time spent alone in a controlled and positive environment. Explanation: separation anxiety can be managed by gradually desensitizing the dog to being alone. This involves slowly increasing the time the dog is left alone in a safe, comfortable space while using positive reinforcement to reward calm behavior. Option A might not address the root cause of anxiety and simply confining the dog in a crate. Option C, without addressing the emotional issue, can exacerbate the problem. Ignoring the behavior, option D, could worsen the anxiety and lead to more destructive actions. Question 28. Scenario: Mr. Thompson has just adopted a rabbit and is concerned about its diet. The rabbit is not eating enough hay and Mr. Thompson is worried it might have digestive problems. He asks for advice on the best course of action. What would you recommend to help Mr. Thompson address the rabbit's dietary needs? A. Increase the rabbit's access to fresh vegetables while reducing hay to encourage eating. B. Provide variety of pellets to improve the rabbit's diet and stimulate appetite. C. Ensure that hay is always available and encourage the rabbit to eat it by offering fresh herbs or leafy greens. D. Limit fresh water and vegetables to force the rabbit to eat more hay. Answer: C. Ensure that hay is always available and encourage the rabbit to eat it by offering fresh herbs or leafy greens. Explanation: hay is essential for a rabbit's digestive health as it provides the necessary fiber to maintain healthy gut. It is crucial to always provide access to fresh hay, and offering fresh herbs or leafy greens can help encourage the rabbit to eat it. Reducing hay or offering too many pellets, options and B, can lead to diet issues. Limiting water and vegetables, option D, is not advisable and could further stress the rabbit or lead to dehydration. Question 29. You are responsible for feeding a group of exotic birds in a sanctuary. The birds have very specific dietary needs, and some of them have shown signs of malnutrition. Which of the following should be your first step in correcting their diets? A. Immediately switch to a commercial bird feed that promises to meet all their nutritional needs. B. Consult with an avian veterinarian to determine the bird's specific dietary requirements based on species and individual health. C. Increase the amount of fruit and vegetables provided, as these are the main source of nutrients. D. Provide high-protein foods, as they are the most important nutrient for all birds. Answer: B. Consult with an avian veterinarian to determine the bird's specific dietary requirements based on species and individual health. Explanation: the first step in addressing malnutrition in exotic birds is to consult with an avian veterinarian who can assess the bird's individual health and species-specific dietary needs. Birds have highly specialized nutritional requirements, and a one-size-fits-all approach, such as switching to commercial feed option A, may not address the specific deficiencies. Increasing fruits and vegetables, option C, or providing high-protein foods, option D, can be part of the solution, but a veterinarian's guidance ensures the correct balance of nutrients. Question 30. You are tasked with handling a large animal, e.g. horse or cow, that is known to be sensitive and may react aggressively if approached incorrectly. What is the safest and most effective method to approach the animal? A. Approach the animal from behind to avoid startling it. B. Approach the animal slowly from the side, ensuring it can see you and is not surprised by your presence. C. Approach the animal quickly to avoid giving it the chance to react. D. Approach the animal while making loud noises to alert it of your presence. Answer: B. Approach the animal slowly from the side, ensuring it can see you and is not surprised by your presence. Explanation: the safest method of approaching a large animal is from the side, where the animal can see you coming and is less likely to be startled. Sudden movements or approaching from behind, option A, can increase the risk of aggression or fear. Approaching too quickly, option C, can also make the animal feel threatened. Making loud noises, option D, can startle the animal and lead to aggressive behavior. Always use calm, slow movements to ensure the animal remains relaxed.